I'm going to talk about two conditions that are very common: an acute condition and then a chronic condition. An acute condition is a condition that has occurred really within the last few days, and the pain has been lasting for 2 or 3 days and has not gone away. I can help with those conditions generally very quickly. So someone's been doing sports, or they've been in a car accident, or something has happened and it's thrown their back out or their neck or their shoulder. If you come to see me within a very short period of time, I can help with the treatments that I do. A chronic condition is a condition that's been going on for longer than that. Sometimes those conditions can be going on for a month, 6 months, 10 months, a year, 10 years, 12 years, and people have learned to live with it. Oh, my mother had a chronic condition, my dad had a chronic condition, my grandparents had this, so I'm going to have to learn to live with it. And the answer is absolutely not. A chronic condition is simply a condition where your body has been thrown out of balance and you've not gotten the proper care to bring it back into balance. A lot of times there's a gap that has been created between where you need to be and where you are, and you've just not been able to bridge that gap. And I can help figure out what has caused that gap to occur. When people leave a condition that has been going on for a long time and they just learn to live with it, generally it does not get better. It will get worse over time. Chronic conditions are actually my favorite conditions to treat because I'm really good at figuring out where the cause is and to develop a treatment plan to bring that condition back into balance, whether it's your low back, whether it's your neck, whether it's numbness down your arm, whether it's something that's a sciatic problem that's been going on. A lot of times people will seek out my care when that chronic condition gets worse and worse and worse. Oh, they've been living with it for all these years, managing it with ibuprofen or medicine, or maybe even possibly injections. And then they'll go to the medical doctor and they'll get some x-rays or maybe some advanced imaging like a CAT scan or MRI and figure out that there's some degeneration that's gone on in the back. And then they're told, oh, you've got some arthritis or some advanced degeneration. Well, guess what? If you're over 20 years old, you've got arthritis. It doesn't matter. You're 30 years old, you got a little more arthritis. You're 50 years old, you're going to have more arthritis. It doesn't mean that that is the cause of the problem. The cause of the problem is an imbalance somewhere in the body. It's become chronic. And so people think, I've got chronic low back. Well, you have chronic low back because it's been hurting for a long time, but that doesn't mean it needs to continue hurting. So I can help figure out specifically where that problem has occurred and develop a treatment plan and a protocol to be able to bridge the gap between where that chronic is and where feeling good is. And I can figure out to bring and to close that gap and get you feeling better. Now, with a chronic condition, if it's been going on for a long time, it's going to take a lot of treatments to bring the body back into balance. But it doesn't mean that you have to live with this for the rest of your life. If your pain is severe, we can make you feel a lot better with the treatments that I do.